It's hard to stay positive these days. Take a look at your phone, turn on the TV, or pick up a newspaper. And the news about COVID-19 is prevalent and scary. COVID-19 is an infectious disease pandemic that is spreading more rapidly than our healthcare resources can handle. The core ethical issue requires taking the right measures to sustainably safeguard a high-quality and effective healthcare system, whilst at the same time mitigating the serious adverse consequences of the measures for people and society. And decreasing the spread of the pandemic also requires that individuals and governments need to take responsibility for us to overcome this pandemic. So I recommend thinking ethically about masks and vaccination. Vaccination and mask mandates will push us all to be our better selves, to protect ourselves and others from the health, economic, and social consequences of unchecked pandemic. And also, good ethical decision making may be our only hope. Because amidst the chaos of a global pandemic, we have to work hard to help evangelize the rest of the world to become a people of competence, conscience, and compassion for all and for the hope of a better tomorrow. In other words, we need to apply ethical decision making. I also recommend the ethics of isolation and social distancing. Isolation and social distancing impose limits on an individual's freedom and autonomy and is justified by the principle of utility. One acts to maximize aggregate welfare. For quarantine to be ethically justifiable, there must clear evidence of person-to-person spread of potentially this serious disease. The restrictions imposed on people must be proportionate to the harms. And of course, the travel restriction and border controls should be in line with WHO recommendations and be flexible to accord with international recommendation. I also recommend patients with symptoms should be tested because early diagnosis and supportive treatment are in their best interest and because most of the spread is thought to result from actively symptomatic patients as more tests and tests with properly or better detection rates become available. And I also recommend on how people and government use ethics to mitigate the spread of virus are the two values that are particularly important for facilitating a positive relationship between the government and individuals, which is the trust and solidarity. Because working together requires trust and solidarity in order for us to solve societal problem, which is the COVID-19. Government must communicate clearly how they balance conflicts between collective health and individual rights and values and what the chosen strategy entails in terms of collective and individual responsibility. While experts can provide number and facts, individuals need to involve in determining which decisions are made and how decisions are made. For people to be willing to take responsibility to develop the habits necessary for managing a pandemic, we need to trust our governments. Trust is rational and requires that the trusted party be worthy of trust. However, trust in public health officials has decreased in the past few years. This has led to parents refusing to have their children vaccinated. There are many reasons why people mistrust vaccinations, including concerns about safety and efficacy, religious belief, and social norms. If the public lack trust in the authorities, then they are unlikely to act on the suggested measures to prevent spread of the pandemic with a consequent increase in mortality. A COVID-19 vaccine may be effective in reducing community spread and or preventing disease in individuals. Mandatory vaccination is most justifiable when there are benefits to both an individual in terms of preventing transmission. If the benefits are only to individual adults, it is more difficult to support mandatory vaccination. One justification would be to prevent exhaustion of healthcare services in an emergency, which has been used as a basis of restrictions of liberty. It could also be justified in the case of protections of children and others who cannot decide for themselves, and of other adults who either cannot be vaccinated for medical reasons.